Parkland Hospital in Dallas is seeing a sharp increase in COVID-19 patients. 4 days before the expected peak in Texas for deaths, that's May 2nd, 2 days before the expected peak of hospital bed usage, and also just days now before the state of Texas will reopen some businesses. Fox 4's Sean Rabb spoke with doctors who are concerned. Sean.
Yeah, they cannot explain what's happening at Parkland, but they say the numbers there are different than what's happening in the city of Dallas and across the state. The numbers at Parkland are going up. That plus not really robust testing, diagnostic testing yet across North Texas, makes some in the healthcare community concerned about the reopening Texas for business right now, especially in North Texas. In announcing phase 1 of reopening Texas for business, Governor Greg Abbott said there had been across the state 7 consecutive days of COVID-19 decline in cases. But that is not the case at the Dallas County Hospital, Parkland.
In terms of the numbers of patients that are coming in sick enough to be admitted to the hospital, in terms of the patients who are being admitted to the hospital or sick enough to require intensive care and mechanical ventilation, those numbers have been going up pretty significantly for us over the last 7 to 14 days.
Dr. Matthew Lovino and VP of Nursing and Surgical Services at Parkland, Samantha Rowley.
Really, at Parkland, we have been pulling our nurses from all over.
Lovino says the virus not just attacking the frail.
It's pretty devastating for, a large group of people that normally you would think would be pretty resilient.
And why some are bothered by Friday's limited reopening with planned ramp up for businesses to 50% capacity by mid-May.
We've oftentimes mentioned that in an ideal world, we would prefer to see a longer period of time before reopening and certainly large chunks of time between stages.
It looks like we've tested about a 1%, just a little more than 1% of our entire county's population. That's it.
Dallas Mayor Eric Johnson says testing equals success to reopening the economy.
Failure in this case means people losing their lives. It means people dying, and I can't have that. And that should be unacceptable to everyone.
If you thought staying at home was hard, this next phase is actually going to be harder. And the reason is there's going to be well-deserved excitement and optimism, but we really need folks to maintain that thoughtfulness and maintain those safe practices of wearing masks, hand washing, and keeping physical distancing.
So that is the point that everyone wants to underscore. You really have to take steps to protect yourself, face covering, the social distancing between other people, especially as community wakes up, as the economy opens up and people begin to move around. There will be additional cases. That's expected when people start moving around outside of their homes. What we have to watch for is what healthcare and county officials will be watching for as well. How many of those people are sick enough to go to the hospital? And as Dr. Matthew Lovino said, sick enough to be in intensive care, sick enough to have mechanical ventilation.